Hi, I'm Kimberly Jaimes, the nurse manager for the Adult Emergency Department and Trauma Center at the University of Florida Health Shands Hospital. The Adult Emergency Department has 62 beds located on the first floor of the South Tower campus. As a department, our goal is providing expert care and experience to every patient that enters our door. Currently, we average about 150 patients per day. Prior to COVID, we averaged approximately 180 patients a day, and we ranked second in the nation among like hospitals in patient acuity. Our high acuity level is a direct reflection of our Level 1 Trauma Center designation for all adult and pediatric trauma alerts, comprehensive stroke center, chest pain accreditation with resuscitation, burn center, ventricular assist device destination therapy certification, SANE Center for Excellence, and transplant services for solid organs and blood and bone marrow. Our nurse to patient ratio is 1:4, with the goal of decreasing that to 1:3 due to our level of acuity. We have a dynamic team that is made up of registered nurses, paramedics, critical care techs, mental health techs, monitor support techs, stock techs, and guest service specialists. The best part about working in the emergency department is the availability of resources, which includes personnel and equipment. For example, if you have a patient that goes unresponsive and you're the only one in the room, you literally just have to say, "I need help in here," and 20 people will show up at the door within seconds. Needless to say, you're never alone. We thrive off of teamwork and collaboration to provide the best care possible for our patients. In regards to orientation, new nurses will have a 16-week minimum orientation, and during this time period, you will get exposure in every area of the department, including trauma, with a dedicated preceptor. There will also be a 4-hour weekly didactic lecture that is system-based. For example, you will have a cardiovascular lecture with hands-on training with cardiac monitoring equipment like EKG machines, telemonitors, defibrillators, etc. Then the next week, you will participate in a high-definition simulation for a patient that's having a cardiovascular event like SVT, and identifying what interventions are needed for this patient. Then you will go on to the next lecture. Throughout your orientation, the clinical leader will touch base with you and your preceptor on a frequent basis to ensure that all your needs are being met. We also incorporated your BLS, ACLS, and PALS courses within this 16-week time period. Near the end of your orientation period, we will have you team with your preceptor in a 7-room assignment. And then after orientation, we will mirror your schedule with your preceptor's schedule so that you can have that resource readily available. We want to make sure that we set you up for success after your orientation. Yes, the ED is a complex and fast-paced work environment, but it's a breeding ground for learning, teamwork, critical thinking, and nursing skills. I can't wait for you to come join our team.